official opening. We couldn't be more thrilled to have Valerie Pringle join us today, who is an amazing champion for our children and youth, and we just thank her so very much for coming here and supporting us today. So I'm going to introduce to you Mrs. Valerie Pringle.
Thank you, Sarah. I'm very honored to be here, to be with you, and to be among you, because I believe this is such an important thing. I was thinking, quite frankly, I mean, if anyone had asked me 5 years ago if I would be spending really most of my time as an advocate for mental health, I would have said, no, not likely. This has been an issue that's literally come and grabbed me. And at this point now, I feel like there really isn't anything much more important that I can do with my life. I mean, my husband and I were certainly inspired a number of years ago by Michael Wilson. I know you probably saw his ads when he started putting those ads out for the Center for Addiction and Mental Health, talking about his son's suicide. And here was this very public figure, but low-key private public figure, who was talking about this and saying that stigma should no longer be allowed. And Michael had been a partner with my husband, and so we supported very much what he did for Canning. And then at one point they said, come down and look around. So I did. I went and toured CAMH with the wonderful David Goldberg, and I was so moved by what I saw, really. The Dickensian facilities, which you guys probably knew about so much longer ago. I think the thing that broke my heart most as I looked around was hearing that in this huge 600-bed hospital, there was no gift shop. A hospital with more beds than Sick Children's Hospital, Mount Sinai, other wonderful facilities in this city, but not basically the economic traffic, the human traffic of people coming to visit people who were in CAMH for treatment, to even warrant a place where they could buy flowers or teddy bears or that sort of thing. I found that just a staggering statement about where our society was. So after I took that tour, I sort of immediately signed up to be a volunteer for CAMH. I joined the campaign cabinet. I said, I'll help you raise money. I'll be on the foundation board and see what I can do, because I felt it was such an urgent social justice issue and so needed. I also said, because they asked me if I would do one of those ads, which again, I mentioned Michael Wilson, one of the Transforming Lives ads that we saw all over the city, that so many wonderful people had been involved in. James Bartleman, the former Lieutenant Governor, Lincoln Alexander, former Lieutenant Governor, so many people who stood up and said, this has affected my life and we have to start talking about it and breaking down stigma and fighting against it. And it's interesting that that ad campaign was what particularly galvanized me. Because when I was asked to do it, like many of you, in my family, my extended family for sure, so many people have suffered from mental illness and substance abuse. Bipolar, alcoholism, drug abuse, many things. And I wondered, who can I talk about? I finally came to the point where I thought, okay, my daughter, who suffers from panic and anxiety disorder, Catherine, has always been very honest and open about what she went through. And after she'd gone through it and talking with employers and friends. So I said to Kath, is it okay if we do this about you? And she was more than willing. But the two of us really had some reticence. We thought, you know what? She's really not sick enough. Her story is not as sad and compelling, certainly, as so many of those ones that we've seen, like Michael Wilson and James Bartleman and John Tapscott and others. And we thought, really, is there stigma against panic and anxiety disorder, or, taking antidepressants? Who in this city doesn't know someone or being touched by that or have that themselves? We really thought, it wasn't much of a story. And the CAMH people said, no, wait and see. You will see, what an impact you can make. And so I did the ad, went on bus shelters all over the city and radio ads, and it was a fall campaign followed by a spring campaign. And I was stunned. I was so completely wrong in my thinking and my analysis of this. Instantly, people were to Catherine and saying, thank you, I've never talked about this, I've been so ashamed, I've hidden. You know, I realized that people were absolutely dying to talk and asking for help, and there was an enormous hunger for openness and permission to fight stigma, and that completely changed our lives. The single most distressing fact to me, since I've been speaking about this and looking into it more, is that 80% of all psychiatric disorders emerge in adolescence. And there are still so many people in our society who do not believe that children or adolescents can have a mental illness. The statistics are breathtaking. 1 in 7 Canadians under the age of 19 is likely to have a serious mental disorder that impacts their development and their ability to participate in common activities. And as you know, the even worse statistic is that 1 in 5 Canadian children get the health care they need. 1 in 5. I mean, if only 1 in 5 people who needed a hip replacement got one, there would be a revolution. This South Lawn would be covered with people. But somehow, silence has allowed that to exist. So we know what happens. The kids suffer in silence from panic and anxiety disorders, eating disorders, schizophrenia, bipolar disorder, depression, substance abuse, often concurrently. And I don't need to draw you a picture of what happens. The kids are in their rooms and they're crying and they're cutting themselves and they're self-medicating with drugs and alcohol. They're struggling at school. They're struggling with friends and relationships. And they're committing suicide. And the entire trajectory of their lives and their future can hang in the balance of whether or not they get help. My urgent feeling is that we must work harder to create a society where we are much more aware of mental illness and addiction in children and adolescents. And in this world, everyone, teachers, university dons, camp counselors, employers, GPs, parents, everyone can see what's going on, can understand what is going on, and interfere in the very best sense of that word if they see reasons for concern. And then, obviously, we need the resources to help more than 1 in 5 children. We are failing in that regard. There has to be better access to care, and then we must also spend the dollars and fund the research to help us understand what is happening and why, and how we might be able to fix it. And finally, and I guess this is still such an important thing, you know, and I still struggle with this, it's 2010, but we have to end stigma, the elephant in the room. Mental illness, as we all know who are here, is hard enough without adding shame to the mixture, and shame is such a horrible and destructive emotion. Having said all that, I do believe there is hope. Most mental illnesses can be treated. We are learning more and more about the brain every day, and we are seeing changes in people's attitudes. Pretty much everyone affected by mental illness and addiction, either themselves or their families or their co-workers, is starting to recognize that they are not alone. I mean, you hear this about anything that happens to people. You've got to reach out, join support groups. You're not alone. One of the organizations that I'm involved with, apart from CAMH, is something called the Canada Post Foundation for Mental Health, which was just started 2 years ago, really led by the president and CEO of that organization, Moya Green. But the 70,000 employees of Canada Post, the largest organization in this country, have identified mental illness and substance abuse as their cause of choice. And what they do is that every October they sell mental health stamps, which I'm hoping you will buy. And you can make donations in loonies and toonies at the post office, and a lot of their suppliers donate money. So this year they've raised $1.5 million, and all that money gets distributed every single year to frontline organizations all across the country, preferably in small places that can offer immediate help to individuals and their families in terms of access, in terms of amazing how little money can go so far. I remember one of the grants we gave in the very first year, which was last year, $10,000. It's really so little, but it allowed a helpline in Montreal to stay open all night. And one can't imagine that even that ability to be able to take a call in the middle of the night might have helped someone, and undoubtedly did easily save a life.